All right, and we are live. Thank you so much for joining us. We have our enrollment coach, Jen, as well as our program chair for the RN to BSN program, Dr. Jane DeGoyer. And my name is Caitlin Schmidt. I'm the Director of Enrollment Management here at Mercy of College of Health Sciences. I'm going to pass it off to both Jen and Dr. DeGoyer to give a brief intro of what their roles are here at the college and how they support our RN to BSN students.
My name is Jen. I'll start off. I'm Jen Amaya. I am the enrollment coach for Mercy Plus online programs, which means that I am the admissions counselor and the academic advisor for the program that we're talking about today, the RN to BSN.
And I am Dr. Jane DeGoyer, and I have a lot of history with Mercy College, and I feel very, very strongly about the college and the program. I graduated with my diploma in nursing many years ago. And now I finished my BSN, my master's, and my doctorate now, and I'm back here throughout my career. I started as an adjunct, and I really liked the teaching aspect. So now I've been here at the college full-time for almost 10 years. So I've taught in various programs in the nursing department, but this is kind of my passion. My jam is the BSN completion. I've been that nurse working hard on the floor, thinking about my future as a nurse and what would make me stronger and what would make me a better applicant for a position. And certainly furthering my education has helped me do that. And so yes, that's what I do. So I'm lead over this program, and then we have several very well qualified, very experienced adjunct faculty that work in the program as well. And they're awesome.
Well, wonderful. Well, thank you both. We're really excited to talk about our RN to BSN program today and how we support students as they are looking at expanding on their associate degree in nursing, going on and getting their bachelor's degree. So Dr. DeGoyer, I'm wondering if you would be able to give us a little bit of an overview of the RN to BSN program and really why you think it's important for nurses to consider coming back and getting that bachelor's degree.
Well, I have to tell you, I'm a fan of nursing. I've never regretted this career, and I think every nurse is very valuable, an ASN nurse, a BSN nurse. But I think nursing is really viewed by everybody in the public and as a leadership role, and you as a bedside nurse are a leader. And so this really, whether you have aspirations to change or grow in leadership role, or you want to be that strong leader on the unit you work with your patient and your family, this program really develops that. We really help you with how your professional communication in talking with other healthcare providers and talking with the patient and their loved ones, in delegation, in working together in strong teams. This program really helps you develop those skills. One of the things that I love about this program too is we just redid it all and updated it all a couple of years ago, and we worked with national healthcare instructional designers, and we worked with leaders in healthcare to understand the current healthcare trends and what we're facing, because we've certainly been facing a lot in the last few years, and we will continue to, and what is needed from a BSN prepared nurse to do that. And so we looked at, they need to understand healthcare finance, they need to understand research and leadership and that kind of thing. And so this program is also aligned with the American Organization of Nurse Executives to really put the nurse executive competencies, to embed them throughout the curriculum. So it's just, we're seen as leaders, and I think we need to earn that feeling and that opinion from people, and this program will help you do that. One of the things too that I have to say about this program is we have a really good orientation. There's nurses who come to us right from an ASN program, and there are nurses who come to us who haven't been in school for a long time. I was that nurse, and I was scared to death. And we have a really strong orientation course that you will take that really get your arms around what your resources here are here at the college, what the online kind of the whole format looks like, and to get you comfortable with writing. I think that's the biggest fear of many of our students is, oh my gosh, I can't write that way. We'll help you there. We'll get you there. And you have tremendous support here. So that's a big strength that I think we have in our program. So what else, Caitlin? I could go on and on.
I love it. Well, and I think you bring up an important point too, that you have nurses from all different stages of their careers joining this program. So you have some who have really recently just completed their associate degree, and then you have others who have been out of school for many, many years, you know, and so you have different resources to support them no matter what stage that is. Is that right?
That is right. And, you know, one of the things that I love about this program too is we listen to our students. And when we were redeveloping this program too, we really listened to student feedback. But some of the feedback that we continue to get with this format, and since we've redeveloped this, is how much they love working together. And they didn't realize that in an online format, they would have that kind of collaboration. And we have, one of the things we have in this program is we have weekly discussions, and they're true discussions, where we have certain topics we're talking about, but the cohesiveness they develop as classmates and as peers, and with current work situations going on, with current projects they're doing, is very, very strong. And they really appreciate the differences in where they are at in their career, and they all feel like they really grow from that. So I think that's a really important strength.
Oh, awesome. Well, and on that vein too, Jen, you play an important role in the success of our students as they go through the program. You really work with them from the front end, from the very first time that they inquire about the program, all the way through graduation in an academic advising role. So can you kind of speak to how nurses can maintain their work-life balance when they're enrolled? Can they really do, you know, work, school, and job all at the same time?
Well, Jane and I have discussed that before as well too. And you know, you are going to be busy. I won't sugarcoat that one. You're going to be busy. I would say probably, I don't even know if I've met a student who is not working full time. I was going to say maybe 99%, but I think probably 100% of the students are working full time and going through this program, which means it is possible, it is doable. They are asynchronous classes, which means that the courses are offered at your convenience. You don't have a set class time where you have to log in and, you know, at 3 o'clock every Tuesday or something. That means that you have to set up a schedule that works for you, for your lifestyle, with some discipline in there as well. There are set due dates for assignments, even though it is an asynchronous program. So you do need to keep up with that and log in regularly. But yeah, it's certainly doable for working adults. It's a part-time program. So you're taking usually 2 classes, possibly 3 each term. Full-time would be considered 4 classes. So you're gonna be busy, but it's not to a level that's not manageable. So I would say that for sure. There certainly are supports available. There is, you know, Dr. DeGoyer talked about the writing component being an issue or an obstacle for some students. There is a free writing tutor, which is really popular with our students. That's a free service. It's included in your tuition. There's also career services. The Narcitis Student Success Center has career services available to you. There's also academic advising through me or Dr. DeGoyer. We get either one of us help. Other services that I thought were interesting to note was there's, you know, teletherapy services. So like telehealth therapy services that are included in your tuition, as well as obviously, you know, disability services. If you had a learning concern that you wanted to have addressed, that's certainly something that we could address as well.
Awesome. Yeah. I think that one of the big strengths that we have here in all of our programs, whether they're online like RN to BSN or any of our others, is that emphasis on success outside of the classroom being just as important as the success inside, because we know that they're so woven together, and whatever those complications are that arise in students' personal lives, it can bleed over to academics. And so we really have a lot of support systems to help them during whatever might come up during their enrollment. But kind of shifting to some of the content within the program, what students get really excited about, I think sometimes is reading over those course descriptions and understanding what they're going to be studying, how it's going to enhance their career. Dr. DeGoyer, could you talk a little bit about the different courses that are offered in the program and how specifically they're going to enhance a student's career in nursing?
Sure. We have, there's 9 core courses that you'll be taking, and that's including the program orientation, but you'll have courses about holistic nursing, which students love this course. You'll have courses that guide you in informatics and healthcare finance that really help you understand. I mean, we all know electronic charting, but what informatics really can do for us in our healthcare system, and the possibilities with it is incredible. And nurses' favorite topic is never healthcare finance, but that course, after they take it, they're like, oh my gosh, it's so important. It really talks to you about what it means, how Medicare affects other health insurance reimbursements, how that affects our payment systems, how that affects our patient outcomes. So it really helps you get a basic understanding of that. So again, not only would you be prepared as a leader, but you can talk to your patients about some of that when they have questions, because if we don't understand it, they certainly don't. But we have a community health course that's very rich as well too. It's the only course where you have something outside of the asynchronous time. You will have 30 hours. Much of your work is done through simulation, but you will have 30 hours where you will find whatever community you're in. We have people from all over. So whatever community you're in, you'll find a BSN prepared nurse who works, for example, serving the community and preferably underserved needs. So if you are aware of a shelter that has employs a nurse, home hospice is a very strong one. Nurses often like to work with school nurses, but you will locate a nurse to work with for that time during the term that you take that course. And students love that course. But then, some of the other things you'll be doing, the leadership course is rich. It is just rich. It talks so much about our profession and really what the nurse leader does, and how that's where we really focus on working with teams and delegation and that kind of thing. Oh golly, I could go on and on. There's just so many things in the program, but it sounds overwhelming when you first talk about it, that how can we do this in 4 10-week terms? But it's the need to know. It really hits the important information that you need to know. And the feedback we get at the end of courses where nurses write their reflective essays are just heartwarming about how they grew in that time period and what that has meant to them and the different courses. So
I love it. Lots of professional development.
It is a lot of professional development. One of the things too that I love, and I'm sorry, I keep thinking of other things, but we have a health advocacy course that I think is so important, because we are that patient's advocate, but we are also our own advocates. So you will learn much about advocacy, both for healthcare of our populations, but also for our profession. And students, they do so well in that course, and they really grow and learn in that, in ways we can, as a bedside nurse or as an educator, work to advocate for ourselves and for our patients. So.
Oh, that's phenomenal. So it's drawing on a lot of the initial reasons why they chose to go into the nursing profession. It's just not all getting bogged down with the managerial and administrative tasks. It's really just continuing the nurture. Yeah, I love that. I love that. So Jen, I know one of the biggest questions that we get when someone is considering coming back to school, especially for a second degree, they might have already taken on some student loans at this point, is really how financially feasible this is. Can you speak to some of the financial aid, scholarship, tuition assistance, all of those kind of possibilities that exist for RN to BSN students?
I'll try to talk about a few of them. Hopefully I hit most of them. The one of the probably the key things to take away is that the program cost is overall just over $10,000 for the entire program, which is a phenomenal price, a phenomenal tuition price. Of course, there's books in addition to that. But yeah, the program fee is just a little over $10,000 for the entire program. With that in mind, there is a loan repayment program through Mercy One. If as a Mercy College graduate, you work at Mercy One, you can get up to $25,000 in loan repayment. That's $5,000 a year for over 5 years, which is a phenomenal program. That would more than pay for this program. It could help you pay for your associates if you haven't paid that off yet, for example. This program does qualify for federal financial aid, so any aid you would qualify for would be applicable as well. And of course, there's also scholarships that are available through Mercy College or independent scholarships as well. So those are all funding sources that are available to you. That loan repayment program is certainly one that catches most people's attention. It's $25,000. It's pretty big. It's a big ticket. I get that. You could also look into other employers if you're working elsewhere. Check with your employer to see if there's a tuition reimbursement program. There possibly is a tuition reimbursement program if you're currently working as an RN. You would check with your human resource department for that.
Absolutely. And I think it's notable too that a lot of employers do want to have their nurses go on and pursue their bachelor's degrees because of the increased capacity that they're able to take on and the opportunities that open up for them down the road. So what we find with a lot of our students is that if they time it correctly with the fiscal year, then they're able to get the degree virtually paid for by their employer. And that's something that we see commonly here with Mercy One, but we have students, obviously, with this being an online program from all over the country. So it's definitely something that you should contact your employer about and see what tuition assistance opportunities are available. Since this is a $10,000 program, it's very possible that you could get the program completely or at least partially paid for through your employer.
Right.
All right, next, I really do want to highlight Dr. DeGoyer. You have multiple degrees. You have your bachelor's in nursing, you have your master's, you went on and you got your doctorate. With each of these degrees, how do you feel that they have added to your career as a nurse? And how do you think other students can be potentially inspired by your own personal story about how these pursuits have added to your own career?
A very good question. I feel like I've been a student for a long, long time. And I'm so glad I've done the degrees that I've done and have grown. I have to tell you, when I first graduated from school, I worked in critical care for 8 years, loved it, never thought I'd want to leave that. Well, then of course, you grow and different opportunities arise. And so going back and completing my bachelor's helped me to meet that. And then I went into a clinical leadership role that required my master's. And honestly, I know it may sound kind of odd, but I was thrilled that it required my master's because it was something I'd been on the fence about, and I did it, and I loved that program, and it really helped me grow as a nurse as well. But then when I knew in later years that I wanted to go into education, I really had to look at which kind of a doctoral program was a good fit for me. And I got a doctorate of education degree, and it has so supported the changes I've made in my career and given me the ability to make those changes and the comfort to make those changes and make me an accountable person in whatever role I've been. I don't know anybody who's advanced their degree who's ever regretted it. To me, it's been more of the push to get on the start of it all. But we are here to help you do that. And we are so excited that you would be considering this. And yeah, I would do it again in a minute. I'm glad I don't have to. I would do it again in a minute. I really loved my educational path and feel like it's done nothing but support my career. So.
That's wonderful. I think it's notable, just to interject here too and say that we do have a Master of Science in Nursing with an emphasis in organizational and systems leadership as well. So that is another online growth opportunity as far as your education. If you're watching and you're inspired by Dr. DeGoyer's story, then there are more opportunities to go on past your bachelor's, get that master's, even potentially get that doctorate someday. There's so many different things that you can do. Come back and teach at Mercy College.
You'd love that. And the RN to BSN program would prepare you for graduate nurse or graduate education. There are some people who have a passion for being a CRNA or a nurse practitioner, and your bachelor's degree would prepare you then to enter that master's degree program. Of course, we're going to think you're going to want to be the Master of Science and the leadership here, but the RN to BSN supports you to go on into graduate education. So I'm really glad you brought that up, Caitlin, because it's so important. We're in such a challenged time in healthcare, and we need nurses, and we need strong, resilient nurses, and we really want to help you prepare for that.
Absolutely. Well, and I think that brings to my mind just one more strong point I want to mention before we kind of add some closing comments is just that we do have the support here for you. What I love and what I think is so missional about what we do at Mercy College is that we have these programming opportunities where students start out with their Associate of Science in Nursing. They're working full time. They're doing that program in the evenings and weekends. And then they go on to our RN to BSN program, still working full time and able to pursue their education in the margins of their schedule, and then going on and getting their master's again in a part-time capacity. So it really enables you and empowers you to continue moving along in your career, but also investing in yourself and your education at the same time. So if you're daunted by some of these opportunities that we're pointing out today, just know that it really isn't just you. We're all in it together, and you have really caring staff like Jen and faculty like Dr. DeGoyer who are here, who have been in your shoes before, and they're excited to encourage you along in the process. So before we go, I just want to ask both of you, both Jen and Dr. DeGoyer, what encouragement do you have for someone who is a nurse? You know, they're busy and they have a family, they have their job, and we know that nurses can be stretched thin these days, but what encouragement can you give to them if they want to take this step, but they're just not quite sure?
I would say reach out to Jen and talk about it. Jen knows the mapping of, if you start this term, what your map would be, if you start the next term, what that map would be. Also, you can complete this program in as few as 4 10-week terms, but you don't have to do it that quickly either. So I'm going to tell you, work with Jen. She is incredible with helping students map their plan. Certainly, if you have any program specific information, I'm happy to talk to you anytime. But I would say start. I would say just dip your toe in and get started. And then the next thing you know, it's the next term. And the next thing you know, it's next term. And it will fly by, and you will be done, and you will have that degree, and you won't regret it. Just get started.
I would agree with Dr. DeGoyer. I mean, there's always going to be an obstacle. There's always going to be something that's in the way. Something in life that's going on that's hard to manage. There's always going to be those things. It's up to you to decide to make that determination if this is the right time for you, and only you can determine that. And because it's ultimately you that's going to be doing the work. And we're here to support you and help guide you, do whatever we can to help you through the program. But yeah, do some introspection and kind of see if this is really the right time for you in your life. But again, there's always going to be an obstacle. There's always going to be something that's going on. Like I said earlier, I think 100%, if not, we'll say 99%, because there probably are somebody who is not working full time. But I would say, if they do it, why not you? Why not you?
Mm-hmm.
Why not you? Really?
I love that.
You can do it.
Yeah, inspiring and challenging.
Yes.
Well, thank you both so much. And thank you everyone for joining us. Just a reiteration, our RN to BSN program, it is 1 year. It is online. It is $10,000 even before you're looking at financial aid coming into play. So it's doable. We hope that you'll consider our program. Visit mchs.edu and look for the big green apply button if you're looking at applying. Otherwise, there are ways to connect with Jen on our website as well. And she would be happy to answer any questions, do a phone appointment with you, chat over email, whatever it is that you have kind of standing in the way, or just those lingering questions that you have before jumping in. We're here for you. So with that, I will go ahead and close us out. We'll see you all next time. Thanks. Bye.